I am very, very excited because Lygeia Ricciardi, who is the Director of Consumer eHealth at the ONC, the U.S. Department of Health and Human Services, is here. And we've actually had quite a bit of time to talk about what's going on with Blue Button. And it really felt appropriate for us to talk about at CES. And she's even going to talk to you about a special event thing that we're going to be doing in San Francisco as well. So I want to read to you her motto: growing old is mandatory, growing up is optional. I'd like to welcome her to the stage.
Thank you, Jill. All right, can you hear me? All right. So I think I need to update my hair picture because growing hair is optional, but I did, and so it looks a little out of date there. I'd like to actually start this off with a video. So could we run the file that I gave you guys?
The test results. You may be called upon day or night to accurately remember and report every single detail. It's your responsibility to keep the health data for yourself, your kids, your parents, Great Aunt Emma. They all rely on you to remember it all. What if you were unavailable when your mom needed it? What if your child had an emergency and the best treatment was delayed because some vital information wasn't at your fingertips? Now, with Blue Button, you can have reliable online access to your family's health information anytime you need it. Your health information is available now, and you have every right to access it, check it, use it, and share it when you need to. Visit healthit.gov/bluebutton and take control of your health. With Blue Button, the power of your health information is in your hands.
So I want to talk to you guys about Blue Button, which is not, unlike most things at CES, a product, but it's a brand and also a movement that you can be a part of. Blue Button is a growing public and private partnership that supports the policy goals of better health and cost savings. Mike? All right, should I speak into this? Is that better? Excellent. So Blue Button supports policy goals, again, of better health outcomes, better quality health, and better costs, and also business growth. So it's kind of a win-win as a public-private partnership focus. It began at the Veterans Administration in 2010 when they put on their basic patient portal the Blue Button image, which allowed vets to click it and download a copy of their data in a very simple format, their health records. But it's grown far beyond that. And in fact, the Department of Health has been charged with really trying to take it nationwide and to include not only basic health records, but a lot of other kinds of data too. There was a lot of discussion this morning, particularly with the first panel, on branding and the importance of branding. So I want to start off by talking a little bit about Blue Button, the brand. It's really a symbol and a brand that can enhance your brand. As we heard from Alexandra, brands don't go it alone these days. They're often combined. And so I want you to think about Blue Button the way you might think about Intel. Think of Intel Inside, or as they say now, Intel Look Inside, or Energy Star, or USDA Organic. These are all brands that are seen on very diverse kinds of products, but they indicate that those products share common qualities. So for example, with Intel, you've got PCs, tablets, the Internet of Things. But if you've got Intel Inside, that means it's fast, it's powerful, it's reliable. Energy Star, you might see it on a refrigerator, a washing machine, an air conditioner, but it's energy efficient. It's also going to help you hopefully save money and at the same time save the earth. USDA Organic, again, meat, vegetables, you name it. Point is, whatever it was produced using certain standards that help to guarantee that this food is relatively good for you and the environment. So what about Blue Button? Really, at its base, it means consumers can get their damn data, to quote Dave and Abby, and get it electronically in a form and a format they can use. They can access it, check it, use it, and share it. I won't go into the many reasons why that's a good idea. What kind of data can they get? Well, they can get their medical record from their doctor or hospital. And again, as Abby's already talked about, through meaningful use, the majority of providers, including smaller practices and hospitals, are using EHRs now and are going through the process. In stage 2 of meaningful use, there's a requirement, essentially, that patients be able to blue button their data, that they be able to view, access, and download it. So that phase 2 is rolling out now, and we will see increasingly in the months and years ahead a greater volume of data flowing directly to you, the consumer, via your medical provider. So, and that's further bolstered by the HIPAA modifications that Bettina mentioned, this right that you have as an American to electronic access to your data if it's available electronically. So in addition to that, though, Blue Button can apply to other kinds of health data, like health insurance provider data, claims. Already, Aetna, United, Kaiser, Humana, the Blues, Medicare, which alone covers about 50 million Americans, are all using Blue Button to share consumer data electronically. And as more people sign on to get insurance through the ACA, the proportion of Americans that have access to their health provider data, their claims data, is going to go up. So also the labs. There's more and more direct-to-consumer access to lab results. Quest, among others, have signed up to do this. And we're seeing retail pharmacies, too. I'll say that you should watch for an announcement in the near future from some of the major retail pharmacists in the country about using Blue Button. One surprise to us, and this shows that Blue Button really is a public-private partnership, the pharmaceuticals have decided to jump on board with this as well. Pfizer, Novartis, and Eli Lilly came to us in the government at ONC and they said, we want to Blue Button our data to share information from clinical trials back to the consumers who participated in them. And we said, great, join on. You can make this all part of this whole movement toward greater access to data. So, what's the appeal of this brand and concept? I mean, to the consumer, it's obvious, we've talked about it. I can get and use my data here. This company that is making this data available provides a service that's valuable to me, and it's part of growing a greater ecosystem of apps and tools. Using the same logo everywhere, I just heard Abby use the phrase low cognitive load. If you see a consistent brand across many industries and products, that means, oh great, that's where I go to get my data. You don't have to think through a lot of wordy explanation of that. And I think increasingly, as more and more data flows, there are more and more apps that are being developed that are really valuable to consumers. Already there are 17 that use structured Blue Button Plus data, and we expect to see more, in part through some of the challenges that we at ONC and others are holding. So I think it's also important to emphasize, water break, from a business perspective, if you're a company that creates or holds consumer data, it's important for you, obviously, in this age of ever bigger data and ever more sources of it, to think about how you want to sort of play in the sandbox. The old model is to create data and hoard it, essentially. And the new model, there we go. Thank you. The new model is to provide value to consumers by sharing it, analyzing it, and adding new value, kind of like what Abby was talking about in making data beautiful. I think increasingly, obviously, there are a lot of companies that play the role of, we're going to follow that older model of hoarding data, but increasingly, I think that's going to be harder to do, and it's not going to be as appealing to consumers and to other partners. And in using Blue Button and that symbol, in sharing data, you're participating in this sort of newer age in which information is really exchanged and value is what's created, and that's what people compete on, creating value, not just holding data. So also in using the Blue Button brand, because of the government component of this, you are aligning yourself with a federal government initiative that supports policies and standards so that it's not just a private sector effort. So again, Blue Button is baked into meaningful use. It's also baked into certain kinds of standards development. So, okay, it's nearly lunchtime, you're thinking, this kind of makes sense. I'm hoping you're thinking that. And you're thinking, how do I do this? How do I get involved? How does this apply to me directly? Well, first of all, my colleagues and I in Washington have been spending a lot of time on websites recently. And we think we've learned something about how to build them and how not to build them and so on. And we thought we'd release a website, but we're going to do it in beta. We're going to sort of do it gently. And what we really want to do is invite all the folks at CES to be a part of, we're calling it the Blue Button Connector, which is a website that helps consumers find my blue button. You want to find out, does my doctor offer this? Does my pharmacy offer this? How do I know? So it's going to be a site where you can go and figure out who offers you your data and also get links to the apps and tools where you can use it. So this is a good consumer tool, but it's also a good tool also, for developers who want to find where they can find sources of consumer data that they can pull from. And we really want to encourage you to be a part of that site and to participate in it. Additionally, there are a whole set of technical specifications called Blue Button Plus, which we developed together with 68 volunteer organizations, and we released last January. And essentially, they help folks to move along a continuum of using Blue Button, which starts at the very simplest level of let's release data and let's make a pledge to share data with consumers, and becomes more complex. We want people ultimately to be using structured data, and Blue Button Plus guidelines lay out that structure, both for those of you who hold data and for those of you who are going to be, or who are already building apps and tools that use it. We also feel it's very important that you use the brand because of this idea that we want this consistent recognition across industries and across products. So in terms of other materials and resources we have for you, you saw that public service announcement that I opened with. We did some research and focus groups and tailored messages to several different consumer groups. This one is geared toward caregiver audiences, but there are also ones for the chronically ill and for people who are above 65. And we would encourage you, these public service announcements are going to be run by a lot of major consumer organizations starting later this year. And we would encourage you and your company to also run these PSAs and other collateral materials and to co-brand them if you like. So I think Blue Button is something that's really going to take off in the year ahead, and you really have an opportunity at CES to be in at the ground floor and be involved and also help propel it forward. All these efforts are tied together via the Blue Button Pledge program, which is free to join, easy to join, and I have a sheet that I can give anyone who's interested about how to do that. So lastly, if you are a developer, you can work with us. You can join ONC and CES at the Digital Health Summit in June 18th, 19th, and 20th in San Francisco, where we'll be really focusing on Blue Button and helping you use Blue Button Plus and build apps and tools that are going to be really appealing to consumers. So that's it. Come on up and talk to me if you're interested. I also have a limited number of these beautiful Blue Button pins for those who are intrigued. So come see me afterwards. Thanks.